I have a very good question next. It's kind of the million-dollar question that I want to pose to the panel. Somebody asks, what could patients do to help close the biomarker testing gap?
Yeah, it is a very important question. And I think, as I mentioned, a lot of this comes down to being aware, like awareness of, the biomarker testing, being able to, I think Dr. Rose's slides had ask and advocate. And I think that's very important. As a patient, you want to, at every stage of where your cancer treatment is being discussed or sort of changed, you want to ask your oncologist, that do I need to repeat biomarker testing? What are we basing the decision on, to really trying to understand, what their biomarker testing is from a cancer standpoint. What does their cancer sort of genetically look like? I know obviously we rely a lot on electronic health records. I advise my patients, and I usually print out their biomarker testing results and have them keep a copy as a document, because when they go from one healthcare system to another, this is sort of the thing that's sort of lost in translation, buried in fax machines and whatnot. And so I think it's very important, if for them to be aware, sort of really have that document when they are trying to seek a second opinion or something, to actually have that to be able to show and get a decent opinion on what the next step would be from each oncologist. And I think from a caregiver standpoint, again, I think it's important to understand what your loved one has in terms of biomarker testing, what is needed, and again, being there in the clinic, asking questions, noting down the questions you want to ask for your treating physician, as to how are we going to sort of decide the next line of treatment, or this particular line of treatment, why are we doing this? Can we do something more targeted? I think those are the questions really to ask for.
Dr. Lin or Dr. Roos, do you have anything to add to that? I think that was a great answer, Dr. Desai, to a hard question.
Yeah, I agree wholeheartedly. And I think I already see patients making a difference, actually. I have seen second opinions where patients come and tell me, I had heard from a friend of mine that this absolutely needs to be tested for. And so I asked about it and it was done. And this is what we found. I think sharing your stories can be really powerful in terms of how the biomarker test and what it's led to in terms of treatment options. In the patient advocacy groups, that can be really helpful as well. So I think many of you are already doing to kind of spread the awareness, and continue to do so will be very important.